The impact of COVID-19 is changing the economic landscape around the world, including the SADC region. As the pressure mounts, industries are moving swiftly to build resilience, while governments are mobilizing to safeguard citizens and manage the social and economic fallout. Combining these factors with the ongoing lockdowns around the globe, the platform to trade fairly is slowly being skewed, with some players losing while others are winning. This morning we are joined by Duduzile Simelane, Director for Social and Human Development at the SADC Secretariat, for an update on the region's efforts to harness the fight of the COVID-19 pandemic amongst its member states. Good morning, ma'am, and welcome to Good Morning Namibia.
Good morning, and thank you for having the SADC Secretariat on the show.
Very well. In the first instance, please talk to us about the SADC regional response to COVID-19.
Thank you. SADC has responded to COVID-19 in a variety of ways. This has included measures at the member state level, as well as the regional level, where the SADC Secretariat plays the leading role. As you will be aware, member states have put in place, since the beginning of COVID, member states put in place public health measures to keep the curve at low levels, and also repurposing the facilities that they have. This includes financial and human resources to be able to respond to the pandemic. This also has been around strengthening response systems and mechanisms, as well as addressing the economic and financial impacts that have been experienced by member states. So assisting businesses and commercial entities to recover in the midst of the pandemic. And in this way, trying to balance between the health interventions and the economic interventions, because as we know, during lockdowns, there was a lot of the economic sectors were highly impacted, and there was very low turnover in those sectors. At regional level, we as a SADC Secretariat has worked with member states in coordinating the information or dissemination of information across member states. As you know, during a pandemic, it is important to share information so that the country itself understands what kind of an epidemic or pandemic they are facing, but also to understand what is going on in neighboring countries to be able to respond. So that information has been disseminated in all SADC Secretariat media platforms, including our website, and they have come in the form of bulletins, as well as a consolidated and synthesized bulletin that is available to member states, which offers some recommendations for implementation. We've also undertaken sector-specific studies looking at impact on different sectors and making recommendations so that member states are able to respond in the new normal. And this has really informed programming, as we know that the pandemic is going to be with us for a very long time. So we've been alive to that and making sure that our interventions are going to be relevant as we get into or embrace the new adaptations that are critical as we move forward in the midst of COVID-19. Thank you.
Thank you very much for that very broad overview, ma'am. Now, these interventions, these responses are in pursuit of mitigating the impact of COVID-19 on the region. And you have touched on it during the introductory remark, but please talk to us more comprehensively about what the impact has been on the SADC level.
Okay. The impacts have been wide-ranging. Weak health systems have been overwhelmed in the region, as in other countries as well as elsewhere. We've also experienced a lot of health worker morbidity and mortality at some point in the pandemic, in the first wave in particular. We saw a lot of health workers being infected, and a good number of them have passed on. So that is one of the impacts in terms of depleting resources, human resources, in particular at the health sector level. Education was affected. As you know, schools were closed, and member states had to rearrange the scheduling of the education and program last year in particular. But we also see a lot of countries at this moment closing schools because we are in a third wave at this moment, and that has had a devastating effect. And of course, we do know that the education outcomes have been affected because it's not every child or every learner who has access to online resources. So the education outcomes have definitely been affected. As indicated earlier, the economic and financial sectors have experienced very low turnover from COVID-19 or during the period of COVID-19. We know that businesses closed, factories closed, and the lockdowns did not make things easy at all. And that includes job losses, income losses, and the informal sector was highly impacted because the informal sector depends on going out on a daily basis and trading. And if there are restrictions, people cannot buy anything, people cannot sell anything. So those losses were very disruptive. I must add that in terms of transport and movement of goods and services, there were very many disruptions in the entire transport value chain. Countries were not able to receive goods on time or even send out goods on time through in terms of trading. So the entire transport value chain was affected, and also what that means is that essential goods coming into countries such as food, such as medicines, which were in high demand at the time and which still are continuously affected. Tourism is one of the sectors that was highly affected due to travel restrictions, as we are all aware. The airline industry, which is a big contributor to the tourism sector, also suffered greatly and significantly. So those are some of the impacts I can highlight to you in our interview this morning that were very devastating to the sector, to the region in its entirety.
Ma'am, as we wrap our conversation this morning, talk to us about the vaccine rollout within the region at this particular stage.
Member states are in the process of rolling out vaccines, as we may be aware. Most of the vaccines that SADC countries are acquiring are those that are mainly sourced from the COVAX facility and the African Union Vaccine Acquisition Task Team, which is known as AVAT, as well as through bilateral negotiations with manufacturers and friendly countries, those countries that will make a donation to a country. So rollout is underway in the member states, although the supply and actual rollout remains low, very low to even confer herd immunity in the population. I must add, though, that other countries have done well in terms of rolling out. We talk of Seychelles, which is sitting at 95% at this moment. So some countries are demonstrating very good capacity in rollout. And I must also add that slowness in rollout can be seen at two fronts. One, in terms of availability of vaccines in a particular country, which is administering what has already been supplied in the country. And for a variety of reasons, some countries have not been able to administer fully because of capacity constraints in terms of vaccine infrastructure in a particular country. So in a nutshell, I would say rollout is underway, although quite low to confer herd immunity, but the SADC region is moving ahead in terms of COVID-19 vaccine rollout. And I think that's the comment, that's a brief comment I'd like to make in terms of vaccine rollout in our region.
Speaking about brief comments, just your very brief concluding remarks, please, ma'am.
Come again?
Your very brief concluding remarks, please.
Okay, my very brief concluding remarks from our side is that we are in a third wave. We encourage member states, SADC citizens, to still adhere and comply to the COVID protocols that each country has put in place. Vaccines are available, and people should not shy away from vaccines. We do know that vaccines will reduce hospitalizations and severe disease. So I think that's a clarion call, really, to say, let us all be vaccinated, those that are eligible, of course, because countries have different protocols on eligibility, but just to make the call and also say we are in a third wave, we need to be vigilant at all times as individuals, but also as government. Thank you.
Thank you very much for your time, ma'am.
Thank you.
There you have it, Madame Duduzile Simelane, SADC Secretariat Director for Social and Human Development, talking to us about the Secretariat's response to the COVID-19 pandemic. We'll be back